patients with portopulmonary hypertension who did not undergo liver transplantation have a poor prognosis. This is despite the use of pulmonary hypertension specific medications. Even though we see significant improvements in several of the parameters, these patients still do not do well. My name is Hector Cajigas. I am an associate professor of medicine at Mayo Clinic in Rochester, Minnesota.
My name is Michael Kroka. I'm a professor of medicine at the Mayo Clinic, and I'm the senior author on the paper by Dr. Cajigas.
The title of the article is Portopulmonary Hypertension in Non-Transplanted Patients, the results of the largest U.S. single institution registry. This will be published in the December issue of the Mayo Clinic Proceedings. An overview of the findings on this article is that the patients who are not transplanted, who suffer from portopulmonary hypertension, have poor survival. The overall survival at 5 years was 38%, which is significantly lower compared to the survival in patients with pulmonary arterial hypertension in general. We did find that the survival was significantly affected by the severity of liver disease, particularly MELD score calculation. It is important to say that most patients received medications to treat pulmonary hypertension, and even though with treatment there were significant improvements in functional capacity, walk distance, right ventricular function, pulmonary vascular resistance, and some of the parameters that we use to stratify the risk. However, in spite of all these improvements, survival was still quite low. When we analyzed these patients and we noticed what were the factors associated to increased risk of death, we did find that less walk distance, increased right atrial pressure, increased pulmonary capillary wedge pressure, and model for end-stage liver disease or MELD score higher than 15 were all associated with increased risk.
The important thing regarding this paper is that the Mayo Clinic has the largest database in terms of following patients with portopulmonary hypertension. And this is crucial in terms of the follow-up and how patients will do and adjusting medications in the future for their management, both for those that are going to undergo liver transplant and those that may not undergo liver transplant. The next steps that we're going to have with this database is to analyze newer medications that come out and look at the interventions that we are trying to initiate to help these patients with this disorder. The database covers 3 Mayo sites, Arizona, Florida, and Rochester, and provides us with the largest registry in the United States regarding management of this disorder.
What does this mean for our patients? We have to understand and know that Mayo Clinic is one of the leaders in the knowledge and treatment of patients with portopulmonary hypertension in the United States and in the world. This is has been led over the years by Dr. Kroka. And in this particular article, we're describing that even though some of the goals that we look for to achieve with treatment in these patients are not sufficient to actually make them have the best possible outcome. So it is intriguing, and we also need to use these findings to utilize them for the next points in research to try to improve those outcomes that are not the best.
The program that we have at the Mayo Clinic, namely the liver-lung program, covers a lot of aspects of the lung problems that happen in patients with liver disease. Portopulmonary hypertension is just one of those problems that we deal with on a day-to-day basis. Our goal is to not only improve the care of our patients, but to educate our colleagues across the country with reference to new findings, new drugs, modify the outcomes for these patients. And the liver-lung program gives us that opportunity to make certain advances that will be helpful for many people. I would really like you to take a look at that article. It's coming out in the December issue of the Mayo Clinic Proceedings. I think it's very enlightening. Again, it's the largest series in the United States that's ever been published in this particular cohort of patients, and hopefully it will enlighten not only patients, but caregivers to improve the management in patients with portopulmonary hypertension.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.